Jason Durham. I'm a parent that has a child that has been coming to the clinic for well over half of her life. Personal testimony, this clinic saved my daughter's life twice. I know how important the services and all the supports and services that work together, how important it is to the patients. From the point we come into here, we go into that little door to get weighed and get our meds checked. It's all in one folder. Then we go to that other side over there and all in one folder. And then I see Miss Kathy that comes to check on Bailey to see how her diet is doing, how she's gaining weight, how everything's going. And then I have Miss Kay comes and sees how's everything going with Bailey. All from one folder. It's all one folder. And then we get into the room over here, and then we see Nurse Nora. How's Bailey doing? How's Bailey doing? All from one folder. And then we see Dr. Scheck-Snyder, all from one folder. And if Dr. Frierson's here, then they can talk about Botox injections. Or if we have to go somewhere else, Nora sets that up for us. So basically, all that to say, what's important about Children's Special Health Service is that it's comprehensive. It's all in one place. And the fear as a parent that I have is number one is if these children are transitioned out by my understanding the July 1st date. Am I correct on that? The communication between Children's Special Health Services and going to a clinic outside, you lose that comprehensive supports and services. What have y'all started working on how that communication is going to happen between our one folder and another doctor who has a folder? I mean, have y'all started working on communication for that?
Well, the only thing we can address right now is to make sure that the receiving clinic has the medical record, has the history, has the previous notes from the other physicians. After that, if the communication between physicians is up to those physicians.
Yeah, and with that, my understanding, one of the slides showed that, and I heard right that it was a parent's responsibility to contact that doctor and make sure that that appointment is had. So a parent who's already dealing with God knows what, and seizures and peg tubes and whatever, they're responsible for getting their children's appointments, even though the transition is supposed to help, and they've got to get their own records and take them to the doctor. Is that how that works?
We will copy the records, and we will make sure they're sent with a cover letter explaining that that child has an appointment with them and that these are the records for that child.
Okay. Another thing is, let's say, and I know you've heard this before, let's say that we have an I-10 corridor, we've got 3 clinics, hypothetically, we've got ophthalmology Baton Rouge, ophthalmology in Lake Charles, and ophthalmology in Lafayette, and the doctor is going to take, hypothetically, 10 children from each clinic, so that's 30 children. Well, it doesn't become feasible for that doctor to come from New Orleans to a clinic back behind the Old Women's Hospital, and they say, you know what, I'm just not going to do it. So now we have 30 children with ophthalmology concerns. What happens to them?
One of the things that we took into account when we made this plan is we tried to preserve the infrastructure in each region. So we still have our services in every region. There are clinics left open in every region. So theoretically, if we have a new need for a clinic, we can still add a contract and add a new clinic. It's going to be much more difficult because we have to have staff along in order to absorb a cut that's large.
So the children will still be in an outside clinic, they would not be in a clinic inside the children's special. They would not.
No, we can recreate a clinic if our receiving clinic falls through. Then we would just have to have another contract and start a clinic again.
Then y'all would hire nurses and some more nurses as necessary.
Well, we don't have the funds. I mean, that's the consequence of the budget.
So there wouldn't be one.